So let us discuss why proximally based fasciocutaneous flap are preferred for resurfacing of bed sores. We have already discussed why fasciocutaneous flaps are better than muscle flaps or musculocutaneous flaps, but why proximally based fasciocutaneous flaps are better. We know that bed sores occur because of some sort of sensory compromise, and if there is a potential for recovery of those sensations, maybe in a paraparetic patients who has chances of return of sensations, it is always better that proximally based fasciocutaneous flaps are used, so that that particular area which we are surfacing has got sensory innervation potential. And obviously in the follow-up, if there are protective sensations, the chances of bed sore recurring are going to be less. So this is not a general rule as such. Whatever flap fits in better geometrically should be used, but if an option is there, proximally based fasciocutaneous flaps should be preferred.